From the battlefield of Scutari emerged a new tribe of individuals, the nurse. Led by the legendary Florence Nightingale, this tribe quickly became the backbone of healthcare. They witnessed the kingdom of horror in the Crimean War, where more died due to hygiene and infection and less from actual battle injury. It was a revolutionary change that the pioneers brought to healthcare. Today, little can be done in hospitals without this tribe of angels. The modern demands of excellence in healthcare makes a huge demand of them physically, mentally, and more often emotionally. Nurses are unique in kind. They have this insatiable need to care for others, which is a huge source of strength for those who need help. Nurses rise to the occasion every time, be it the Black Swan period of COVID or in the many battles that our country has gone through. This hospital too has its own brand of guardian angels who provide succor to all within. They are a beam of light in the time of darkness. A hospital is proud of our tribe. May they rise from strength to strength.
On behalf of the chairman and the trustees, we extend a cordial welcome to all of you to the Dr. L.H. Hiranandani Hospital. You are an integral part of the hospital's arm in delivering the best healthcare in the country. Be proud to be a part of that team. It is because of dedicated nurses like you that the hospital has grown in a short span of time to be well established in the healthcare space of the country. The nursing department in the hospital has a hierarchical system: Director Nursing, Deputy Director, Nurse Manager, Nurse Executive, Senior Nurse, Staff Nurse, Auxiliary Nurses, and Healthcare Assistants. Each nurse manager looks after a particular area as wards, OPDs, and critical care. They are basically there to supervise to see that all the patient care areas are managed and run efficiently and the patient gets the best possible care. The nurse managers report into the Deputy Director Nursing and executive nurses report into the nurse managers. The executive nurse is responsible for the nursing care. They will supervise your work directly and ensure that all the ward orders are fulfilled and the medication is given to the patient, and also the ward instructions are followed as per the hospital protocol. In addition, we also have nurse educators, clinical pathway nurse, and diabetic nurse educator. They will be your friend and guide for the time you spend with us. They will act as your confidant and see that you blend into the Hiranandani culture of nursing. At our hospital, you not only have to be very good at your work, you also have to look the part. There are grooming etiquettes. All staff nurses wear white shirt and trousers with white socks and shoes. Lady nurses must have their hair tied in a bun with a net. Black-colored hair clips are only permitted. The hair should be neatly combed and tied and not loose or have fringes. They must have a pearl necklace and also pearl stud earrings. Nails must be cut short with no nail polish. We do not permit the use of heavy makeup or strong perfume. You are permitted to use natural colored lipstick and kajal, but this too has to be lightly applied. Use of deodorant is encouraged. Gentlemen nurses must have their hair cut in a close crop and should shave before coming to work. A nurse gives succor to the sick. Part of this process is also to smile when you meet the patient and cheerily wish the patient. It is necessary to wish all in the hospital, seniors as well as juniors. You should also wish all who visit the hospital, as it is this friendly atmosphere which will win the hearts of the patient, and more would like to come because of your pleasant manner. Speaking well and communicating effectively with patients and relatives is so important. Not all of us can do so or never have had the opportunity to do so. To give you a boost, the hospital has arranged for some of the most common questions asked and their answers. You must learn these by heart and also the pronunciation. You will also be tested on this, so don't miss out on the training sessions. You will find that once you master this, you will be able to master other questions and answers as well. All of a sudden your language skill improves and you have improved. You are in a service industry just as your friends in the hospitality industry are, and being polite is the mantra here. In English there are 5 such golden words as may I as opposed to can I, please, excuse me as opposed to what, sorry and thank you. Answering the telephone is very important as the person on the other end may have an important message. There are telephone etiquettes to be followed in this hospital. We will teach you all of that. There will be special classes for such etiquettes and you have to use the same language each time you attend the phone. The manner in which you speak reflects the culture of the organization and may also be a factor for a patient choosing to come to our hospital. Imagine a patient wanting to come to our hospital as they feel that the kindest nurses in the world are here. Once you enter our portals, your hospital starts an induction program for you. It lasts for 2 weeks. We will embark on your journey for betterment. Your hospital is highly process-driven. There are the standard operating procedures, also referred to as SOP, which you will have to read and only know about those that affect you. You will be explained about the different departments of your hospital and also where they are located. To improve your professional knowledge, the hospital runs in-house courses and you are free to participate in such courses. All critical care and emergency care nurses are trained in ACLS, PALS and NRP. To find out more about such nursing education programs, you must ask the executive nurse on the floor where you have been appointed. She will direct you to the person who is responsible, and when the course does start you will be enrolled if found suitable. Nurses also write and publish research articles on various topics. NURCON is the nursing conclave organized by the Hiranandani nurses every 2 years to celebrate the contribution of nurses in healthcare. Eminent speakers across the nation are invited. Your hospital has certain values that you all will come to know as your journey at the hospital progresses. There is respect and dignity for all who are at the hospital. We have to improve ourselves each day that we spend at the hospital. We work together as a team. There are many minds and hands that work with a single purpose, and that is the best patient care. We must render the best possible service to all who come to us. This will make you feel proud that you are a good nurse and are an integral part of a system that delivers the best quality of care. All this is done so that we are forever in line with our mission, to be the preferred choice for healing and good health.